Well, that requires a definition. If we're going to talk about stress, your stress is a constant. So people think, oh, I'm stressed today. No, you're always stressed. You're not just stressed today. Stress is always. It's more, how are you adapting to your stress? If it's inefficient or it feels too much and you're hitting a limit, you're getting feedback for the most part. You're not going to be given too much stress, more than you can handle, or else you crumble right away. But it's more, okay, are you going to figure out a way to adapt to it? Or are you going to say, all right, we've hit our limit today. We're going to take it easy. We're going to rest so we can come back a little bit stronger tomorrow. Those types of things. Like when you go stress yourself out in exercise, your limit lifting is 100 pounds, and then you burn yourself out, but then you can come back to next week and now you can push your personal best, and then you can push your personal best. And that's how you grow, is by being stressed and adapting to stress. So spinal health, since your spine is protecting your spinal cord and your nervous system and your brain's ability to communicate and keep everything in total coordination, if I have my spine healthier with greater motion, with less degeneration, it's more adaptive. And even the overall, what in Harrison's model of the spine says, having the closer to a mathematical ideal of curves, what happens in that is now we're as highly adaptable to stress and all the challenges that the environment and life, mentally, physically, emotionally, are going to place on us, and even chemically, that we're going to place on ourselves. Are we going to be able to adapt at the highest level and grow at the highest level? If we're a little less adaptable, it doesn't mean we can't handle the challenge. It's just we may need more time to do it. When I tell people that have more degeneration, or as they call it medically, arthritis in their spine or in their bony structure, I go, well, that just means that you have to take better care of it than the person with less of that in order to have the same amount of adaptation and function. On the same tone, if you're going to look at something regarding, say, the fertility of the body, and this isn't men or women, it's really, they test for everything when when you see infertility or fertility issues. Are there certain things that are mental? Yeah, absolutely. That's been studied very well. There's certain things chemical that need to be studied very well. One of the things that seems to be overlooked is the brain able to communicate to all the different parts coherently and keep them in proper coordination? And it seems to be one of those overlooked things. Now, we know it in chiropractic. We know that in my family, because that was an issue generations ago where I probably wasn't supposed to exist, and my father and my uncles probably weren't supposed to exist, and they do because someone had the accidental wherewithal, we could say, to wander into a chiropractor's office and get adjusted, not for that condition, but in order to get the spinal function better so that the brain could communicate to the part, and clearly remove some type of interference that was going on into those parts, whether it happened to do with the uterus, the fallopian tubes, the ovaries, things that were going to generate or keep in coordination proper levels of hormones. No idea. And frankly, I don't know how you would study that fine a detail in it in different tests, but we know that when that was removed, everything else just happened to be functioning well enough that suddenly, when we didn't have interference anymore and that harmony and that coordination, suddenly the body conceived and held the conception and carried a baby to term. And we've seen that a number of times with different patients, both male and female. Obviously, the males aren't carrying the babies, but their fertility issues seem to change because now the healthy quality in the blood, in the body and blood chemistry, is changing as far as that goes. So it's certainly a piece to add into that journey. And we've had people that have tried everything, and it's, we're not going to go. And I tell them, I go, well, you're never hurting yourself to at least sit down and make sure that this is not the final piece of the puzzle that needs to be. We've also had people that have had trouble going through the non-traditional routes, and we've taking care of their spines. And while there's not, as everybody would like, the most natural conception, suddenly the non-alternative routes are able to take, because now the body is adapting to stresses and adapting to function and putting things in coordination at a higher level. And then all these little pieces come together, and you'll see them coordinate and cooperate at a higher level. So it's part of overall what I call not, people get caught up in healthcare. It's not or sick care, as we'd say. It's actually working on taking care of your health, your adaptive health. And as a side effect, these other things start to function better. Because when communication is there, and we know we're getting the communication operating at 100%, it doesn't mean everything's completely repaired at an instantaneous level. It'd be nice if it worked that way. It's more that now we know the channels are open. Repair can't happen without clear communication. Otherwise, you have to go in and, take parts out, or you have to put artificial ones in, because somewhere there had to be a communication issue to adapt. That was not getting the signal to keep that going, because otherwise you'd see everything degenerate the same amount over the course of time, maybe accelerate in certain repetitive motions in that, but we don't. We see places that are adapting perfectly fine with no signs of degeneration at all, no matter what stresses are put on them. We see others that are, and in the end, it's all right, how do we keep that communication line open? It's not a perfect thing. It's something that you do have to work at. We try to teach, educate, and empower people in how to take care of their own health, adaptive health to stress, so they don't need constant outside stuff to help them. And if we're providing some of that extra stuff over the course of time, we do.